Hi, I'm Rhonda Capuano with the Trumbull Health Department, and welcome to Healthy Town. This is a show where we examine the health of the community in order to strengthen it. Joining us today is Dr. Rich. Welcome and thank you for joining us.
Thank you.
Today we're going to talk about obesity and how Dr. Rich helps patients and treats patients who suffer from obesity. First, I'd like to give an introductory bio of Dr. Rich. Dr. Rich is a board-certified internist, endocrinologist, and obesity specialist. After graduating from Cornell University Medical College, Dr. Rich completed training in internal medicine at Columbia University and in endocrinology at Harvard. Dr. Rich is honored to have been selected as one of Connecticut's top docs in endocrinology every year since 2010. He has been in private practice with the Fairfield County Medical Group located in Trumbull for the last 25 years. So it's no surprise that we are delighted to welcome Dr. Rich to help us address this issue.
Thank you, Rhonda.
So Dr. Rich, tell us, what motivated you to become an obesity medicine specialist?
Well, first of all, thank you for having me here. It's an honor to come here. I've been an endocrinologist and an internist for the last 25 years in Trumbull, and I was getting very frustrated with my practice. I would see many patients who are overweight and who I knew were going to develop diabetes over the next few years, and all I was able to offer to tell patients to diet and exercise, and invariably they would come back a few years later being diabetic and continue to gain weight. And I did not believe it's because they didn't try. These patients try to lose weight, they were unable to, and I didn't have many tools to sort of offer. I was also frustrated. Many patients would go out and spend large amounts of money spending for different weight loss programs only to gain the weight back. So I felt there had to be a better way to treat these patients. So about 3 years ago, I went back and retrained and became board certified in obesity medicine so I could help these patients better.
Well, weight gain has become a major health crisis over the past few decades. What is the scope of the obesity crisis facing our country?
Well, the obesity crisis is not only facing our country, but pretty much all developed countries. It's believed right now that in our country, 1 in 3 people are considered medically obese. 1 in 3 people are considered overweight. So only a third of the population is normal weight. So clearly something is driving this. And the way we sort of characterize obesity is by using what's called BMI, which takes into account height and weight together. And between 25 and 30 is considered overweight, and over 30 is considered obese medically. Doesn't hold well for people that are very muscular, but otherwise is a very good judge for obesity.
Well, what are the major contributing factors to weight gain?
Well, weight gain, there are many factors that contribute to it. If you start from the beginning, genetics plays a huge role. There are over 100 genes that are known to have some effect on obesity. If you were to take, when there were some studies that had kids that were taken away at birth that were twin children and raised in different families for whatever reason, and about 70 to 80% of their weight was contributed to a genetics. So that plays a huge role. Even things in utero and as a young child sort of set some of the groundwork for weight as you get older. Clearly environmental things are probably the biggest factors considered our modern society. Our food sources, our lack of exercise, portion control, all that stuff plays a huge role. And then also hormonal things within individuals. We know there are factors inside the body, things like insulin resistance, and probably the resetting of part of the brain when somebody gains weight that makes it harder for them to lose weight. So all these factors contribute and sort of have sort of a perfect storm for weight gain in this country. And when you look around, it's no wonder that we do have this. When you look around, you see many people overweight, and it is a major crisis because it leads to many other things.
Why is obesity now considered a chronic medical disease?
Well, diseases are considered medical problems that you don't really control. High blood pressure, you may have some control over, cholesterol and some genetics, and there's a process going on that has complications for the individual. We now, in the past, I think it was always thought that as a person's choice, that's health choices. But now we learned a lot more about obesity, that there are many things that people don't control. The genetics they don't control, the hormonal effects, and so many of these things contribute to obesity that the person does not control and sort of leads to the disease, and the disease in itself causes many health issues. So it's now considered a chronic medical problem, not just a life choice.
Well, what are some of the medical complications then associated with weight gain?
Well, with weight gain, there are so many health issues that go along with that. There's probably considered well over 100 diseases that weight contributes to. Some of the major ones that we are concerned about are things like diabetes, which is also hitting a huge epidemic proportion, and diabetes has many complications that go along with that. We see high blood pressure, cholesterol, and heart disease also very associated with weight. Things like sleep apnea and sexual dysfunction are weight-related often. So those are some of the major things. One of the things that most people don't realize that obesity is also a major risk factor for cancers, and maybe second to smoking, or maybe even equal to smoking. It is a huge cause for cancers such as breast cancers, colon cancer, prostate cancer. So it is a huge risk factor for cancers that most people don't realize. And that's one of the issues we have. There are so many bad diseases that go along with that. And then just the structural things, arthritis and joint pain and joint injuries. People that carry the extra weight carry much more risk of developing those.
Well, can these complications be reversed with weight loss?
Clearly, weight loss will improve most of the complications. Whether totally reversed or not, that depends on the individual. But even a 5% body weight loss will make a huge difference in terms of improving health issues on patients. You probably won't reverse it with that amount of weight loss, but clearly it makes a huge difference. And when they do studies with people with bariatric surgery that have marked weight loss, often we see a reversal of diabetes. We also can see a decrease in mortality in these patients. So clearly weight loss makes a huge difference, done in any way, either by diet, by medication, by surgery. Getting that weight down will help decrease the risk of developing the complications, and also if you have the disease, hopefully make it easier to treat or curing it.
Well, can you give a quick overview of your approach and tools available for treating overweight patients?
When I look at overweight patients, I look at the 5 tools that we have. A lot of them are the old-fashioned stuff that we have. We have diet, exercise, and behavioral changes, which you can't underestimate that, but clearly in the past that have not worked. Now we have some new medications, and thinking about medications and how we could interact with the weight gain on that. And then we also have the bariatric surgeries, which have become much more common and so much safer. So when I look at a patient for weight, I try to go through those different factors. Diet, clearly you need to consume less calories if you're going to lose weight. So getting someone to eat better, healthier is going to be important. Exercise, the more calories you burn off, the less that you have to, let me rephrase that. The more calories you burn off, the less weight you have. Behavioral changes, there are so many psychological factors involved in eating, and stress eating, and anxiety and stuff like that that leads to eating, and trying to improve some of the psychological component really makes a huge difference. And also there's so much guilt associated with obesity that people blame themselves and don't realize that this is a disease just like diabetes and high blood pressure. And most people wouldn't blame themselves if they had high blood pressure, or wouldn't blame themselves if they have diabetes, but they blame themselves if they have overweight. And I think that's something we have to try to help the people get over that blame and really work constructively to help with that. Medications, I think in the past some of the obesity medications had a bad rap because there were some complications with them. Now there's a whole new set of medications that have come out that are beneficial, that seem to be very helpful in terms of weight loss. And then the bariatric surgeries have become so much safer these days that I think that is an option for people that have marked obesity or complications from the obesity, and that probably is the single best treatment that we have today for obesity.
Well, it sounds like a multi-pronged approach. Are there any specific diet that you recommend for weight loss?
When you look at diet, almost any diet works. If you go high fat, low carb, almost any diet will work after a year. The key is sticking to the diet. So when they did studies looking at comparing the diets, while some diets may lose weight faster than other diets, by the end of the year, most patients will lose about the same amount of weight if they stuck to the diet. The major difference is how many people stick to the diet after a year, and that's the major difference. My personal philosophy is to eat healthy foods and eat more whole foods to try, rather than the processed foods and the carbohydrates, to eat healthier things that'll be healthier for you in the long run. Probably the best diet out there in terms of health is probably the Mediterranean diet. A diet that's very high in things like olive oil, nuts, lean meat and fishes and vegetables. And those diets have been shown probably long-term to be one of the most palatable diets, so people will stick with them. Also have great weight-losing potential and also may prevent some complications from diabetes and other diseases. So my preference is to try to lean people towards that type of diet, a healthier diet that they can stick with, and that's going to be the key.
That is the key. How important is exercise in promoting weight loss and maintaining that weight loss?
Well, exercise, I think, for health is vitally important. When you look at people as they get older, the people that do well and feel well as they get older and have better quality of life as they get older, exercise is probably the #1 predictor. If they're able to get out, move, and just to function, it makes such a huge difference in terms of their quality of life. In terms of weight loss itself, exercise by itself is not a great weight loser, because often you compensate by eating extra food if you exercise a lot. And I'm a runner, and often I go to these 5Ks where you run 3 miles and burn off probably about 400 calories, but then people have 2 bagels afterwards, so at the end they sort of gained probably a little weight. So unless you go along with the diet, with the food along with that also, it's not really very effective in terms of weight loss per se. But in terms of people that lose weight, the #1 predictor of who maintains the weight loss is exercise. So it's amazing in predicting who maintains the weight loss. When they went back to look at The Biggest Losers, which was a TV show where patients lost huge amounts of weight with heavy exercise and diet on TV shows, went back a number of years later, the best predictor of who maintained the weight loss were the people that maintained the exercise. The people that were able to continue the rigorous exercise, at least an hour or so a day with good amounts of exercise, were able to maintain much more weight loss than people that stopped doing that. So it is probably the best treatment to maintain the weight loss. It will help with losing weight loss if you continue with the diet and other mechanisms, and that's very important.
Are there any medications that can help an individual lose weight?
Medications also, when I look at medications, I look at it in 3 different ways. I look at medications, the first way I look at medications that people are on. There are some medications that people are on that can cause weight gain. So if some of these medications are causing weight gain, stopping them or lowering the doses may help. And then I look at weight-losing medications as 2 types of medications, and I'll go back to both of them in a couple of minutes. One is diabetic medications that can have weight loss properties, and the other is some of the anti-obesity medications, some of the newer anti-obesity medications that are out there that can help. In terms of medications that can cause weight gain, there are some older diabetic medications that can cause weight gain, and insulin can cause weight gain, and sometimes you need them. Things like sulfonylureas and insulin can cause weight gain. Some of the psychiatric medications can also cause a lot of weight gain, and that's often very challenging. Things like prednisone and some antihistamines can cause weight gain. So sometimes taking people off of those medications or changing the medications are very beneficial in preventing that weight loss. Preventing that weight gain and stuff. In terms of diabetic medications, there are one of the old-time medications, something called metformin, which is not used as an anti-obesity medication, is often the first-line treatment for diabetes, but often can have a weight-losing property to it, so it's often a very good medication to start patients on, since many of them are prone to diabetes anyway. And then there are a couple of the classes of diabetic medications that also have weight-losing properties, so they sometimes can be used off-label to help people lose weight. And then the more exciting part now is some of the newer anti-obesity medications. As I mentioned in the past, there were a number of medications like fen-phen and some of the other medications that were taken off the market because of health issues. But what they've done is gone back and re-engineered some of these molecules and found other combinations that seem to be helpful in weight loss. And now there are 4 medications that are approved for weight loss. One's called Belviq, one's called Contrave, one called Quizmia, and one's called Saxenda, all working in different mechanisms to try to help people lose weight. The mechanism by way they help to lose weight is generally through the hypothalamus. The hypothalamus is the portion of the brain that sort of controls hunger and appetite, and by decreasing those mechanisms can often help with weight loss. Unfortunately, in our study right now of that, we don't know how to predict which medication would work on which person, so a lot of it is trial and error. Give the patient medication, see if they lose weight, and if they do, continue it, and if they don't, then to discontinue it and try another medication. But those are some of the ways that we sort of look at medications now at this point.
How about the role of bariatric surgery in the treatment of severe obesity, and which patients would benefit from this type of surgery?
In terms of treatment for obesity, bariatric surgery is probably the most effective. Nothing we could do in medication, at least right now, can compare with the bariatric surgery. But bariatric surgery is an invasive surgery, and there are some complications associated with it. But now we have much better surgical techniques and much better safety records, and probably the risk of bariatric surgery is sort of similar to the risk of having an appendectomy, so it's a very low-risk surgery these days. There are 2 major surgeries that have done. One is a sleeve surgery where they sort of narrow the stomach, and the other one is the gastric bypass where they sort of rearrange a little bit the bowels, and they both work very effectively in terms of decreasing weight. And it's interesting that in the past we always thought the weight loss was all because of the change of the size of the stomach. As we're learning more, it's probably more than that that contributes to the weight loss. We know that when you change the structure of the bowels and stuff, you change some of the GI hormones, and some of these GI hormones have an effect on the brain, so those may be some of the factors that contribute to weight gain. So by changing that, you can lose weight that way also. And also, one of the other big factors that's been understudied these days is bacteria in your gut that contributes to weight gain. Some of the unhealthy bacteria, especially people with bad diets, and the surgery make you have a much more favorable bacterial flora in the stuff, and that may also help lose weight. So there's many mechanisms by which that work, but it is a great treatment for that. In terms of which patients qualify or should be considered that, patients who have a BMI of greater than 40, that's considered stage 3 obesity, or patients that have BMIs above 35, but have medical complications such as diabetes, heart disease, sleep apnea, or other complications from their weight that can be corrected with that.
Why is it so difficult to maintain weight loss? I think this is the question everyone wants to know.
I think one of the things we have about weight loss is that we think of it as a quick fix, and it's not a quick fix. So if you go, one of the reasons I don't believe in diets per se is when you think of the word diet is considered, you're going to go in something for a couple of months and then you're done. And a chronic disease can't work that way. A chronic disease is a lifelong disease. So just like you're not going to treat high blood pressure, taking blood pressure for 3 months and then stop and expect your blood pressure to still be good, the same thing with obesity. You can't treat yourself for 3 months, lose weight, and then expect it to stay that way. So while eating healthy and changing lifestyle, I think, is very important because that's something you can maintain. You can maintain healthy eating and exercise and hopefully maintain the weight loss. You need to go into it with that type of attitude. There's also other factors, biological, that contribute to that. Some of the understanding of weight these days is that once you gain weight, the body almost readjusts to that weight. So if you gain 100 pounds and you're now 100 pounds overweight, your body's now readjusting, considers that your normal weight. And probably through changes in the hypothalamus, in rat studies, you'll see damage to, just biopsies of rats' hypothalamus after they gain weight. you see damage to the hypothalamus. You can't do that in humans, but MRIs show that there probably is a similar type damage in humans, that whatever the weight did change the hypothalamus a little bit. So when you lose weight, your body thinks you're starving. And if you actually were 100 pounds overweight and lost 30 pounds and checked some of the hormonal levels in your body, it wouldn't look like somebody who was 70 pounds overweight. It would look like somebody who was starving to death and the body was trying to pull you back. So to be able to continue treating that, you need to continue with the medications, with the diet. So it is a long-term process. So the mechanisms behind that, and that's the biggest challenge. Almost anyone could lose weight, and the question is, how do you maintain the weight loss? And that's why I don't think any of these quick fix programs that it's going to make you lose 50 pounds in 3 months and then say bye is going to work. Because unless you've changed something, it comes right back, and often you overshoot, so next time you stop being your diet 20 pounds over what you were before. So I think there are many mechanisms, and it's very important to really have a long-term approach.
It sounds very complicated and many levels to it. Well, what about any words of advice that you might have for people who are struggling to maintain their weight?
I think it is a struggle. No one's going to argue that with you. People have weight issues. This is a chronic disease. But the word of advice I say, I always tell people when they come in, when they've lost weight, how do you feel? Invariably, all feel better. You need to keep that in mind. When the weight is down, you feel better, and you just have so much more quality of life. So I think it is a struggle. It's unfortunate that people who have overweight have these conditions, whatever, and it's dealt sort of a tough card for that. But I think doing the treatment, doing the work on that really makes a huge difference. And you'll just feel better, your quality of life will be better, your diseases that you hopefully won't develop will be great. And as I said, even a 5 or 10% body weight loss will make a huge difference in terms of health complications. So I wouldn't even I would shoot for realistic goals. If you're 100 pounds overweight, you're probably not going to go down to normal body weight, but if you lost 30, 40, 50 pounds, you'll feel wonderful and you'll have a whole different outlook on life.
Well, this was really very enlightening to me. Is there anything else you'd like to share before we, thank you?
Yeah, I think there's so much research now going on in weight management and obesity right now, and hopefully over the next few years we'll find more information. I think for a long time the obesity field was always felt to be a self-choice and never felt to be a medical issue, and that has changed. As we've learned more, now we know that it is a medical condition. So I think finally money and research is going into this field, and I think that will make a huge difference in terms of hopefully coming out with better treatments, better drugs. There are a ton of hormonal factors inside the body that may have plenty of effect with that. There are, as I said, gut bacteria. In rat studies, they're able to change the weight of the rats by changing the bacteria in the guts. We don't know how to do that in humans. So there's so many things on the horizon that may be beneficial. The other thing about weight, I think we still need to do a lot of political stuff on that, because weight is still, by insurance companies and other industries, people are often prejudiced against. The medications for obesity often are denied by insurance companies or written off. And I think there needs to be lobbying through government and through political thing to really treat weight as an obesity as a weight issue, as a medical issue that's going to cause other stuff. And that's one of the challenges as a obesity specialist. Sometimes some of the medications and some of the best treatments I want to give somebody, I'm limited because of the cost or not covered by insurances. And sometimes surgeries are denied because their insurance company has written that off as one of the benefits. So I think there needs to be more information out there to the health insurance companies, to the public, to our politicians, to try to lobby for better care for them. And even in daily life, I think there is a lot of prejudice out there about obesity, thinking that this is a patient's choice, and it's not. And it needs to be understood that while people need to work on it, there are mechanisms, and we need to sort of be more inclusive of all that stuff.
Well, this was very important and interesting information. Thank you for sharing it with us. And thank you for joining us on Healthy Town, and we'll see you soon.
Great. Thank you very much.